The Gene Project was set up in 2008 and it's a 3-year programme to address health inequalities in the North East, mainly targeting 2 key areas, Tyne and Weir and the Tees Valley sub-region.
The Gene Project stands for Green Excersise North East. It was first born really through a pilot study in Gateshead, which was looking at the barriers to people become more active in the outdoors. 3
of the key principles within the Gene Project are about engaging local people who are in the most disadvantaged areas. So generally there's a very close link between disadvantaged areas and poor health. So we're looking at those who are suffering from the worst health inequalities. We're trying to engage with those individuals, and the Gene Project is specifically looked at families with young children, young people aged 13 to 25 and those suffering from mental health conditions, and they're the sort of 3 main areas we've looked at.
The importance of the Gene Project is it works with a lot of vulnerable groups, and it's well known the evidence around exercise and outdoors in terms of well-being, both in terms of you get the physical benefits, but then there's also the benefits of being in nice surroundings and the fresh air and how that affects self-esteem, and it has a protective effect against depression, and just can really improve people's well-being.
A couple of years ago there was a pilot study looking at the barriers behind why people aren't becoming more active in the outdoors, and we addressed those issues. The key responses really were time, confidence, certainly with the mental health groups, and also kind of accessibility of the green spaces. So that's why we've set up the Green Excersise North East project.
My role within the Gene Project has been as an operations manager to oversee the staffing. The staff themselves actually manage their own budgets and do the delivery. So my role has been to look at how Gene is integrated within the groundwork and our programmes. And one of the key things for me is to make sure that Gene actually continues beyond the 3 years of funding. And I would like to see it actually fitting in with our current programmes of work, such as land and neighbourhood, so that we integrate it really well within our existing work. And for example, if I'm thinking about improving open green space, if those improvements are made, which are kind of groundworks core work, how can we then involve local people in actually getting more active on that site and making the site more sustainable? So that's my aim. It's to come from a groundwork point of view, but to integrate Gene, which has been one particular project, into our health and well-being and our overall package for environmental regeneration.
In terms of boundaries, Gene Project covers the whole of the North East.
One of the things that we're looking at is actually being very specific about what health outcomes we're meeting, and a project that we're very proud about is our Fit Mamas project, which Faye Guy, one of the project officers, has been running for us, and it's about engaging with new mums and actually offering them a fitness in the park regime.
As my role is at work, I set up lots of different green exercise initiatives across the Tees Valley. I liaise with lots of different groups, and going with those groups we hold focus groups, and then we find out what the groups want to do and then tailor the activities around their needs. So the group that you saw here today, it's a lot of young mums. The feedback that we got was that a lot of the friends had gone back to work, so they were in the house and they as well they were finding it hard to exercise because of the childcare needs. People who were physically active before, they couldn't just go along to an aerobics class because they would have to get childcare and be relying on other people.
I like to come here because you can bring your baby with you as well, so there's not having to find childcare or make arrangements that way. And really just you see the same faces every week as well. You can ask each other questions, and if you've had a problem or you've got a worry or anything like that, then you can ask somebody else, and somebody else has always had the same problem. And also it is a lovely way to get back into fitness. I don't do anything else but this for fitness just because it's so easy to come along, and it is a lovely way to get out in the fresh air, and it's just really enjoyable. And I love how you can work at your own pace as well, so nobody has to feel like they're not fit enough.
It's bringing people together, so it's protecting against social exclusion, it's protecting against postnatal depression, it's getting people together, they have a social aspect, they chat all the way around, and then as well as that, a lot of people, they lose a lot of confidence, they want to get back in shape after having a baby. This group here, it combines cardiovascular and muscular strength and endurance, so it really is building up the fitness levels.
I've been coming to Fit Mamas for about 7 months now, and personally I get to make new friends. I've started to get my fitness back. It's it's great because you can swap ideas on, you know, if your little one's not sleeping very well, then somebody else has got a great idea or a new recipe to cook for their lunches or whatever, and it's just fantastic. And you go home feeling really good because you've actually got out in the fresh air and you've had a really good chat and some good exercise, and it's just really enjoyable.
You start off with some cardiovascular work, you know, where you can take it at your own pace. You can walk or jog or run. You can put as much or as little effort in as you want. And then obviously we come down to the bandstand and we finish off with some resistance. So again, you know, you pick your own level, just do as little or as much as you want.
Some of the outcomes that we're looking at is we're looking to expand our programme. We've got a pilot that we're setting up which is looking at BMI, we're taking blood pressure. As well as that, we're also developing a weight management programme which we're going to link in together alongside the Green Exercise activities. We're also looking at various wellbeing and mental health inventory tools which we've started using, which assess people's happiness, whether that's increased since they started. If you were to ask some of the mums some of the benefits they would get from coming here, I would hope they would say that they enjoy it, they've got the social, meeting people, and as well a lot of mums, I know they mention that the changes in the body, the confidence, and that they're getting that pre-pregnancy shape back.
If there's a new mum wants to come to the class, I'd say, you know, don't feel nervous about coming, just come down because everyone is so friendly. We've all been in that situation ourselves. You straight away meet new friends, you know. It's very easy when you've got something in common, you've got the baby there to talk about. We're all wanting to get back into our shape and our fitness back, and it's a really good class for doing that.
The two workers work very creatively, and my role has been to actually sort of encourage that creativity and innovation. Look at different ways of working, different types of activities. We want things to be exciting. We want people to sustain the activities they're embarking on. One of the things that I think is particularly interesting is Colin's work around cycling, and he's worked with a group where he offers different levels of cycling and fitness. So from the start it's almost like strolling, it's literally getting back onto a cycle and actually just cycling around a track very simply, and that can be added to, and you know, we can provide more challenging activities within that programme, until the more extreme is actually sort of mountain biking and taking on quite challenging trails. So he'll take people right from the beginning, where they're not used to cycling, they haven't got on a bike for ages, right the way through to where they're actually really challenging themselves.
Kind of boundaries that kind of we're really trying to overcome is obviously kind of we cover the whole of the North East, but each group tends to be kind of quite focused in a certain geographical area. So what I would do, I would kind of travel to that group, meet the group, have a focus group, establish what the kind of activities they like to kind of get involved in, and try and plan activities on their doorstep. So literally, you know, some groups are very lucky; they have kind of parks and that very close by, so they can just literally kind of 2-minute walk and they reach a park. Other groups aren't so fortunate, so have to work and look at kind of, you know, public transport, getting to kind of these kind of green spaces to access them and become more active in the outdoors.
The cycling project offers us loads of data to evaluate, and some of the health benefits that are coming out are around increased confidence, increased mental well-being, and I think just being more motivated. People are actually motivated and they're looking at new things outside of what we've offered them, so it's actually leading them on to other experiences.
Some of the key outcomes in relation to the Gene project, certainly for mental health service users, obviously kind of confidence is a very, very key aspect. You know, kind of if they're kind of coming into a group for the first time, kind of very nervous, confidence might be quite low. But when you kind of work with the groups and they can find out what kind of activities they can achieve, you know, kind of confidence increases. They obviously kind of join a social group as well, which is kind of very, very important. And often, you know, we're trying to encourage people to go on to do further training, whether that's kind of cycle leader training, cycle mechanics, or even kind of walk leader training as well. So if people can find they can actually achieve such a lot.
The place I'm at, it was the manager of the place. He said to me one day, "Do you want to do a bike maintenance course?" And I says, "Yes." And we went down to a biker where they learn you how to fix bikes up from scratch. So say you've got a frame, you would have to put the wheels on, you would have to put the brakes on, you have to put the pedals on. And I done all that and I passed the course. And then our service, what I live in, they set up a bike project, it's called, which is up at Cramlington. And basically what we're trying to do is help the community, like fix some bikes up for them. We're a service, we're not expecting any money, we're just like, we're trying to help people that haven't got a bike, help people that have got a bike, fix them up.
If I were to ask a kind of service user what they got from the sessions, I would hope to think they kind of, obviously initially really enjoyed the session, possibly did activities and kind of got involved in things they've never done before, or if they have, something that they've done before and really enjoyed it, and they, from doing this today, think, oh great, I want to get back on a bike again, get involved in take my bike down the local park. So also social reasons as well. I think great, this group is great. I've really got to make some good friends, meet some new people. My confidence has soared.
When I've been out with a group today, it's been quite pleasant, because talking about stuff, getting to know the other people that's like out with you. When you're riding about, there's different views to look at. Getting used to controlling the bike, getting used to pedalling the bike and stuff like that. Getting to know other people's needs and how fast they pedal a bike, getting to know what pace you should stay at.
Some of the challenges of partnership working when I'm promoting Jean are around the fact that we're not necessarily known as delivering within the health and wellbeing sector as Groundwork North East, and we've got to overcome that and actually promote our work and actually evaluate it in a way that the health sector are used to. And just make sure that our monitoring is very clear and actually hits the hard health outcomes that are needed by the PCTs and other partners.
Partnership working with Shoe with Start has been vital in that they've really encouraged the mums to come along. They've promoted the sessions for us, and as well the mums are going there, they're getting the healthy eating advice and all the other educational advice that they need to help them with the baby, and then they're coming along and they're getting that exercise aspect and wellbeing aspect with us. So it's really important that we work together.
Again, it's about partnership working, it's about community liaison, it's about making sure projects are sustainable, just looking for opportunities with different and new partners that perhaps aren't the traditional partners that the two workers would go for. What I'd like from Jean is to look back at the first 3 years and actually have a showcase to say to other partners and organisations and commissioners, look what Groundwork have done within the health sector, and it's really solid work, it's very well evaluated, and it meets the hard outcomes that we're so used to within health and wellbeing, but it also is sustainable, and the people that have been on the activities have actually said, yes, I've really enjoyed that, and it's led me to do something else. I'd like that to be a sort of a legacy within Jean as it is. Going on from the first 3 years, I would really love to see us getting commissions and funding to continue Jean and expand it across the North East. So we're not just targeting the 2 areas, we're doing it across the whole of the region, and hopefully engaging more staff to do it.
Ideally, if we come from very kind of small beginnings, just from initial pilot project to moving up to establishing the Jean project with myself and Faye. We've established now some sessional workers. We've got 6 sessional workers in total. Really, the future, what we like to do is kind of look at more the kind of the hard outcomes. Look at things like blood pressure changes, body mass index. Kind of get some really kind of hard outcomes, which then we can present to commissioners to really to prove that that the package is a very worthwhile one investing in. We'd like to obviously kind of expand, kind of work with more groups for longer periods of time, because the feedback we've had from the groups so far is that the session's been excellent, but just the time we're limited to about kind of a period of about 12 weeks.
If I was to speak to somebody who'd been on the Jean project in a couple of years' time, I would hope that they would have felt energised from the project, they'd have found it memorable, that it was motivating, and they were still sustaining their level of physical activity.